Today I want to tell you a story about an ICU patient who was on the ventilator in very critical condition on multiple medications to keep his blood pressure up. Those are called pressors, tubes in his lungs, in his stomach, and all over the place. This is what we would consider full life support. What was really interesting about this particular individual is I was the admitting nurse in the ICU for him coming up to the ER. And after I got him settled in the room and I went back to my computer and opened up his chart to look over everything, I noticed that every single lab value they had checked in the ER with these preliminary safety checks, every single one of them was normal. Not a single red flag, nothing out of range. If you had just looked at the chart, you would have thought this man was fine. But here he was fighting for his life in an ICU bed on full life support. Now, clearly, that is not a very common situation. But the takeaway for me from that moment is that I realized exactly how dangerous the phrase, "your labs are normal," truly is. Because so often we treat that like an explanation instead of what it really is. So if you have ever had a doctor say to you that your labs are normal and you felt relieved for about 3 seconds before confusion set in, this video is for you. The reasonable trap that so many of us fall into is that we were taught implicitly that normal equals fine. So when a doctor says your labs are normal, what most people hear is, or often what the doctor implies, is that there's nothing wrong. But that's not what normal means. Normal means this: the specific things we tested for did not cross a predetermined threshold. That's it, full stop. It does not mean your symptoms are explained. It does not mean that your body is functioning normal. And it absolutely does not mean that this is the end of the investigation. But nobody ever explains that distinction, do they? And so often, that medical testing that is only designed to answer if you are in danger right now leads you to the conclusion that normal must be fine. See, these tests, oftentimes, not all of them, but oftentimes, they're really for identifying life-threatening problems, things that we absolutely need to intervene on right now. They're not explicitly designed to solve mysteries. So when your doctor is saying that your labs are normal, what they're often actually saying is, I don't see anything here that forces me to act urgently. See how different that is? That's a safety assessment. That's not an explanation. But once danger is ruled out, so often the healthcare system treats the case as closed because it's no longer urgent, not because it's actually solved. And that's the subtle shift where so many people lose momentum and sometimes don't realize it, and even if they do, don't know what to do next. Because those normal results from a licensed medical professional carry authority. They feel definitive and final, like a full stop on your medical mystery. So the question stops becoming what's causing this, and it quietly can become, why are you still here? And unfortunately, that's where so many people start to doubt themselves and start to believe some of the suggestions they've heard, like maybe it's anxiety, maybe you're overreacting, maybe this is just part of the aging process. But those are simply premature conclusions. They're not proven. It's just a substitute that gets put in when an explanation cannot be reached. And This is what I mean when I say that normal often gets twisted into something else. Because a test result that was only meant to rule something out so often gets used to shut down conversation. I want you to hear this very clearly. A test can be accurate and be completely irrelevant. A test can be normal and have nothing to do directly with the problem that you're experiencing. Then that doesn't mean the test is wrong or unnecessary. It means it was answering a different question than specifically the one that you're asking. But patients aren't taught that. So when the data doesn't turn anything up, often we stop looking at what's wrong and start ignoring the patient. Symptoms start getting treated in isolation, if at all. New issues get labeled as separate problems or psychiatric ones. Timeline disappears. Once those things start going in your chart, pattern is lost. Not because nothing is wrong, but because the system decided it was safe enough to stop looking. This is why people leave appointments feeling off, because you didn't go in for reassurance. You went in because something is not right in your body. And normal didn't explain that. It only removed the urgency to keep looking. So here's the shift I want you to walk away with today. If you thought before that if the labs are normal, there must not be a problem, or that the problem must be me, please stop that today. Because I want you to understand that normal only means the obvious dangers were ruled out. The mystery remains unsolved. That's a completely different frame. And it's one of those things, once you see it, you can't unsee it. When you realize how often people are expected to accept closure without receiving explanation, you realize why "doctor says my labs are normal" is one of the most common phrases people search when they're still sick and they're still confused. This isn't a failure of medical self-advocacy. It's a failure of interpretation. Because normal results don't end the story. They just make it harder to keep telling the story. If your labs are normal and your life is falling apart, those two things can absolutely exist at the same time. It doesn't make you difficult or crazy. It makes you unresolved. And unresolved cases don't need more coping. They need better thinking. Not louder, not more emotional, certainly not more aggressive. Just clearer. The hardest part is often knowing how to keep that conversation open when the system thinks it already gave you an answer. And if your labs are normal and your symptoms are anything but, the most dangerous thing you can do is to accept that premature closure just because the numbers look clean. That something's not adding up feeling that you have, it's not drama, it's a signal from your body. But often I've found that the hardest part is knowing how to keep that conversation open without getting labeled difficult. That's exactly why I wrote Words That Work. It is not to turn you into a fighter, but to give you the exact language that helps to keep the investigation alive when the system is trying to end it. There's a link below in the caption if you want to get those words and finally change the direction on your care.